Schizophrenia is a complex and chronic mental disorder that affects an individual's perception of reality, thinking, emotions, and behavior. It is a severe condition that requires lifelong management, impacting both the affected individual and their loved ones. This video explores the symptoms, diagnostic criteria, and available treatment options for schizophrenia. Symptoms of schizophrenia. Schizophrenia manifests through a combination of cognitive, behavioral, and emotional dysfunctions. The symptoms are generally classified into three main categories: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms. Positive symptoms refer to the presence of abnormal experiences and behavior that are not typically seen in healthy individuals. These include hallucinations, most commonly auditory, where individuals hear voices that others do not perceive. Visual, olfactory, and tactile hallucinations may also occur. Delusions, strongly held false beliefs that remain unchanged despite clear evidence to the contrary. Common delusions include paranoia, where a person believes that he or she is being watched or persecuted, and grandiosity, where the person believes in possessing exceptional abilities or importance. Disorganized thinking, characterized by incoherent speech, jumping from one topic to another without logical connections, and difficulty organizing thoughts. Abnormal motor behavior. This can range from agitation and purposeless movements to catatonia, a state of unresponsiveness and immobility. Negative symptoms. Negative symptoms involve the absence or reduction of normal behaviors and functions, leading to social and emotional withdrawal. These include anhedonia, a diminished ability to experience pleasure from activities previously found enjoyable; alogia, reduced speech output or poverty of speech; avolition, decreased motivation to initiate and sustain purposeful activities; flat affect, limited expression of emotions through facial expressions, voice tone, and gestures; social withdrawal, avoidance of social interactions and relationships. Cognitive symptoms. Cognitive impairments in schizophrenia affect an individual's ability to think clearly and make decisions. These symptoms include impaired attention, difficulty focusing on tasks or conversations; poor executive functioning, struggles with planning, organizing, and problem-solving; memory deficits, difficulty retaining and recalling information, affecting daily functioning. Diagnosis of schizophrenia. Diagnosing schizophrenia requires a comprehensive assessment by a mental health professional. The process involves clinical interviews, medical evaluations, and psychological testing. Diagnostic criteria. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, schizophrenia is diagnosed when an individual exhibits at least two of the following symptoms for a significant portion of a one-month period, with continuous signs persisting for at least 6 months. Delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior. Negative symptoms. One of the first 3 symptoms must be present. Additionally, the individual must experience significant impairment in social, occupational, or personal functioning. Other conditions, such as schizoaffective disorder and substance-induced psychosis, must be ruled out. Treatment of schizophrenia. Although schizophrenia is a chronic condition, various treatment approaches help manage symptoms and improve quality of life. Medication. Antipsychotic medications are the primary treatment for schizophrenia. They work by modulating neurotransmitters, particularly dopamine. These medications are categorized into 2 types. First generation, typical antipsychotics, includes haloperidol and chlorpromazine. While effective for treating positive symptoms, they have significant side effects such as tremors and rigidity. Second generation, atypical antipsychotics, includes risperidone, olanzapine, and clozapine. These drugs have fewer motor side effects and are also beneficial for some negative symptoms. Psychotherapy and psychosocial interventions. Cognitive behavioral therapy, CBT, helps individuals recognize and cope with delusions and hallucinations. Social skills training enhances communication and relationship-building abilities. Family therapy educates families on how to support and interact with a loved one with schizophrenia. Supported employment and rehabilitation assists individuals in developing vocational skills and finding job opportunities. hospitalization, and community support. In severe cases, hospitalization may be necessary to stabilize individuals experiencing acute psychotic episodes. Long-term management includes community-based support programs, housing assistance, and peer support groups to facilitate reintegration into society. Schizophrenia is a debilitating mental disorder that affects millions worldwide. While its symptoms can be severe, early diagnosis and comprehensive treatment significantly improve outcomes. A combination of medication, therapy, and social support helps individuals manage their condition and lead fulfilling lives. Ongoing research continues to explore new treatments to enhance the quality of life for those affected by schizophrenia.